to a special video edition of Texas Biomed's Texas Biobytes podcast. Today, we have Dr. Larry Schlesinger, President and CEO of Texas Biomed. Thank you so much for sharing your thoughts with us today, Dr. Schlesinger. It's only the middle of the week, but already it's been a busy week in science. And we wanted to take a moment to get your insight on the latest developments. So with that, I'll jump right in. I want to start with what's on everyone's minds right now, and that is the president's COVID-19 diagnosis and subsequent treatment. There's been some mixed messaging on the true threat of the virus recently. As an infectious disease expert, and given what scientists know and don't know about the virus, what should people be doing right now to keep themselves and our communities safe?
Okay, well, this is a really important question, and you're right, this has been a very busy week. First and foremost, let me send my best wishes to the President and the First Lady for a speedy recovery, and for many others in the White House and around the White House who have been infected with COVID-19. This is a highly infectious virus. And although the rate of serious infection and death is low as reported, this is still a very serious viral infection. And since each of us have a different immune system, a different response to a brand new virus, everyone needs to take this virus very seriously. We are still in the middle of this pandemic. There's still many deaths each day, each week. And therefore, we cannot let our guard down more than ever. We need to do those things that keep us safe. So who's at risk? Everyone. Children, adults, the elderly, all can be infected and vary in the extent to which their infection leads to serious disease and the potential to transmit to others. But everyone can be infected, and you cannot predict that without that infection occurring. This is an airborne virus. We've known for a while that when somebody coughs or talks loudly out, that these particles, called these droplets, can come out, and they can drop out of the environment fairly quickly. And that led to the recommendation that people need to stay 6 feet apart. But I think the data are becoming stronger now, that in addition to these particulates, smaller particles in the range of 1 to 5 microns, which are called aerosols, can be produced by this virus that may transmit it farther than 6 feet. So it's hard to say exactly what keeps you safe, but the farther the distance is, the more you're outside relative to inside, the safer you will be. Because it is airborne, many decades of research have proven the importance of masks. So this should not be questioned. Masks are required. Now, mask and physical distancing in a social environment, we call mitigation strategies. They can't tell you that there's no risk of infection. They just simply reduce the risk. Staying home and seeing no one is your best shot of not getting COVID-19. But short of doing that, the mask is required, the physical distancing, the personal hygiene measures, absolutely required to keep the risk low and to prevent you from getting ill and your loved ones from getting ill.
There are obviously advances that have been made over the past few months in terms of treatment. Obviously, we're making headway on finding a vaccine. But how does the president's treatment differ from the care everyone else receives?
The president got a big dose of several things very aggressively. First, let me say that, I'm sitting here with the information that everyone else has. He had a fever. There's some reduction in what is called oxygenation. His lungs were at normal. This puts him in at least a moderate degree of pneumonia due to COVID-19, in which case being more aggressive is important. He received not only remdesivir, which is at least an emergency use authorization, is used in patients, particularly those that are more seriously ill. He also received steroids in the form of dexamethasone, which is an immunosuppressive agent to reduce what is the most serious consequence of infection, which is your immune system going wild, which can itself lead to a serious outcome. And so the steroids were used to try to reduce the immune system's aggressiveness there. And then he used a truly experimental drug, one that's not yet been approved, that's currently in clinical trials, but the president, through normal processes, got compassionate use for this experimental agent from a company called Regeneron, a monoclonal antibody therapy.
In having received this experimental drug, I understand that this antibody cocktail was actually tested at Texas Biomed in non-human primates. Can you tell us a little bit more about that? What is the cocktail? How does it work? What was our involvement?
Well, first, let me start by saying that I'm excited to tell you all that Texas Biomed played an instrumental role in the development of this antibody therapy. Back in March, the Institute went all in on developing new animal models for SARS-CoV-2, the virus that causes COVID-19. And as a result, have 4 validated models that we're using very aggressively with companies and other partners today on therapies and vaccines for COVID-19, which include companies that are in the so-called warp speed, these large companies that are focused on vaccine development and therapeutic development. And it is because of our expertise in animal models and our ability to do rigorous science with outstanding scientists at the Institute that we were engaged with Regeneron in the further development of their antibodies. And we have had a long-standing interaction with Regeneron. In fact, it was the animal studies of Texas Biomed that allowed Regeneron to put forth its monoclonal antibodies for Ebola virus, which has had a major impact in reducing the outbreak going on in the Democratic Republic of Congo. So Regeneron has expertise in this area. And what we're talking about here are 2 human monoclonal antibodies. So they're perfectly acceptable in our human bodies. And these antibodies are proteins that bind very tightly to a very important spike protein on the surface of the virus. And importantly, there are 2 antibodies here, 2 proteins that bind to different sites on the virus. And what these proteins do when they bind the virus is they neutralize it, meaning it can no longer bind to our cells and instigate disease. Very potent strategy, time honored. Okay, so you've heard about plasma therapy. These are specifically engineered proteins that bind tightly to this spike protein, making these antibodies more focused, more targeted, and more effective. Texas Biomed played a critical role here because once the antibodies were produced, we needed to find out whether they worked in animals in advance of the clinical trials in humans, which is normally what goes on for any new experimental therapy or vaccine. In this case, we used 12 rhesus macaque, a type of primate, rhesus macaque monkeys, which we'd already proven was a really good model for mild to moderate COVID-19. And the proteins were put in the animals before viral infection, so as a way to prevent infection, and then after viral infection as a therapeutic, okay? So a distinguishing kind of preventative therapy from a true therapy after infection. Well, when it was given before the virus, it almost completely abolished viral infection. It was very dramatic. And even given as a therapy after viral infection, there was a marked reduction in viral load. And this was really the first example, I believe, of this highly effective antibody therapy in animals that actually helped the animals stay quite healthy. These data have since been put online in what is called bioarchives. The paper is under review. Texas Biomed features prominently in this publication because of our critical role. And now we're in phase 3 trials with these antibodies. And, it's anecdotal to say whether they worked in our president, but the clinical trials, the phase 3 trials will tell us definitively about the effectiveness of this antibody therapy. And so this is really how it works. And this is the important role Texas Biomed plays.
You talked a little bit in your response about Texas Biomed's expertise in animal model development and regulated studies. So I want to switch topics a little bit. Other great news that's come out this week, of course, was the Nobel Prize Committee announcing the Nobel Prize winners in physiology and medicine. And they were awarded to scientists who discovered the hepatitis C virus. And so that's Harvey Alter, Michael Houghton, and Charles Rice. It's my understanding that Texas Biomed played a critical role in Hep C discoveries, including integral preclinical testing for the cure, for the Hep C cure that's now saving millions of people. But can you share with us Texas Biomed's link to these Nobel Prize winners and their work, as well as our overall contribution to Hep C discoveries?
Yeah, so I'm very pleased to talk about a lot of this because this discovery is intricately tied to Texas Biomed. And it is a great story, and I'll try to keep it simple for the audience here today. So it had already been discovered that there was a blood-borne virus called hepatitis B. That was a Nobel Prize from discovery in the 60s. But what had been disturbing in the mid-1970s is that there was another, what appeared to be transfusion-dependent or blood-borne virus. It kind of looked like hepatitis B, but it wasn't. And it was the initial discovery of Harvey Alter that there was this chronic viral virus causing a hepatitis that was not hepatitis A or hepatitis B. So he called it non-A, non-B. It wasn't until 1989 that Michael Houghton, working at Chiron at the time, cloned the virus. It was a tedious process. You're talking about 14 years to get the virus cloned, at least partially cloned, to get it to a more complete status. And it was really that discovery that led to a blood test and the development of vaccines. And do you know that Chiron had developed a very robust relationship with Texas Biomed on a vaccine development program for hepatitis C? And around that time, a critical lead at Texas Biomed is Dr. Robert Lanford. We have a variety of primates at Texas Biomed. The chimpanzees were absolutely essential for the advancement of viral infection. These chimpanzees, just to let you know, are no longer eligible for any research studies since 2015, which itself has slowed down research in viruses seeking a better model. The chimpanzee was an outstanding model. It was Dr. Rice who came onto the scene with hepatitis C and really proved that the infectious virus itself as a single agent could cause hepatitis in animals, again in chimpanzees. So all three Nobel laureates could not have advanced their studies without Texas Biomed and the chimpanzees at our institute. Now, our expertise in viruses continue, particularly hepatitis viruses. And I think you mentioned just a little while ago, Lisa, that more recently working with Gilead in particular, but other companies, up to 10 different companies, have also been intricately involved in the cures for hepatitis C now that exists for humans, converting a chronic smoldering hepatitis with weight loss, fatigue, fever to now cures. Again, that work in chimpanzees and the critical role all along the way from the inception of hepatitis C discovery, Texas Biomed has played a very strong role. And I'm very proud of that. I'm proud of our scientists and the kind of science we do. Look, we say we do science that delivers. We move quickly, we're nimble, and we have our eye on the ball. We have great foundational discovery science at the Institute, but really we can move that science all the way to discoveries that have impact in the clinic and help save human lives.
Dr. Schlesinger, thank you so much for joining us on this edition of Texas Biobytes from Texas Biomed. I want to thank you for taking the time to explain the week's news to us, and I'm sure we'll catch up with you in future episodes. Thank you.
Thank you very much, Lisa. Great to be with you.